Bushfly infestations and the spread of trachoma in remote Northern Territory Indigenous communities. It has been noticed in recent years that fly infestations seem to be on the increase in the Northern Territory, with flies hanging around past the usual seasons. Fly infestations are considered environmental health risks to humans due to their ability to carry germs and spread disease. Trachoma, a serious eye disease caused by the bacteria Chlamydia trachomatis, is one disease carried by the Australian bushfly that has serious long-term complications. The bushfly is considered to be one of the most prevalent species in Australia and is prone to inhabiting rural and remote areas. Consequently, remote Northern Territory communities will experience greater numbers of bushflies and at a greater risk of health impacts. A Health Impact Assessment, or HIA, was implemented to assess the health impacts of bushfly infestations in remote Northern Territory Indigenous communities. The scoping, identification, appraisal and reporting components of the HIA will be the focus of this report. The scoping stage identifies the structure of the HIA. During the scoping stage, the bushfly's ability to spread trachoma was chosen as the focus for assessment due to several reasons, including repeated occurrence of trachoma can have a significant long-term effects compared to other illnesses spread by flies. Australia is the only developed country with a prevalence of trachoma, and the Indigenous population is disproportionately affected. Despite the implementation of numerous strategies and programs to the elimination of trachoma, the prevalence of endemic trachoma in the Northern Territory has been increasing since 2015. A profile of Indigenous communities in the Northern Territory was next developed to provide a foundation for health impacts to be assessed. Data was sourced from the Northern Territory Government Reports, the Australian Bureau of Statistics, journal articles, and the Australian Trachoma Surveillance Report 2018. In 2016, 1/4 of the Northern Territory population identified as Aboriginal or Torres Strait Islander, with nearly 80% living in either remote or very remote areas. The age profile for the Northern Territory Indigenous population is significantly younger than the non-Indigenous population, with a high proportion of children aged between 5 to 14 years old. In 2018, the Northern Territory had 61 Indigenous communities classified as at risk for trachoma, which is the highest of any Australian state. Within these communities, the Northern Territory had the highest number of endemic levels of trachoma in children aged between 5 to 9 years. The Northern Territory currently implements the Communicable Diseases Network Australia's National Guidelines for Public Health Units for screening and treatment of trachoma. The guidelines follow the World Health Organization's SAFE strategy. A literature search for studies examining the relationship between flies and trachoma was conducted. Key findings include flies present on children's faces at time of screening were identified as a significant risk factor for an active trachoma infection in international studies. Significant positive relationship also existed between flies found on the children's faces and the presence of ocular or nasal discharges, referred to as unclean faces. An unclean face was also a significant independent risk factor for trachoma infections both in the Northern Territory and internationally, indicating a complex and interconnected relationship between trachoma, unclean faces, and flies. This relationship can be explained by the process of the trachoma infection causing ocular secretion. Flies are attracted to the secretion and thus picking up Chlamydia trachomatis. Flies then move from face to face, spreading bacteria and thus increasing trachoma infections within the community. Insecticide was found to be significantly effective at reducing fly numbers in international studies. However, there were mixed results in the reduction of trachoma alongside the reduction of flies. Significant limitation of the previous literature was the lack of recent studies and the lack of local studies that examined the relationship between flies and trachoma. Evidence from the literature review was synthesized with community data collected during the identification stage to determine the likelihood of impacts. Bushfly prevalence was found to be highest in rural and remote areas due to their reliance on cattle dung. Additional risk factors for flies were identified as poor housing infrastructure, poor rubbish and waste disposal, and the lack of sufficient or working sewage facilities. When these findings were applied to the data from the community profile, the likelihood of the Northern Territory Indigenous population experiencing bushfly infestations was deemed as very likely due to the high proportion of the population living remotely and the living conditions within communities. Trachoma infections are most prevalent in children of preschool and primary school age who live remotely and are of lower socioeconomic background. A significant relationship between flies on children's faces and trachoma infections internationally was identified for this population group. The remote Northern Territory Indigenous population has an age profile consistent with this age range, with lower socioeconomic status also consistent. The likelihood of flies on children's faces impacting the spread of trachoma in the Northern Territory was thus deemed as speculative, plausible due to results in comparable populations but limited local evidence to support. However, it is noted that children with unclean faces in the Northern Territory is a significant barrier to the elimination of trachoma. In 2018, 1/4 of Indigenous children in the Northern Territory were observed to have an unclean face. As such, the likelihood of a relationship between ocular and nasal discharge and the spread of trachoma in the Northern Territory was deemed very likely. However, the role of the fly within this relationship can only be speculative. The nature and level of all impacts identified were classified as having a negative effect at a community level. Due to lack of local evidence, health impacts of bushfly infestations on remote Northern Territory Indigenous communities can only be speculative. However, the prevalence of trachoma infections in 5 to 9-year-old Aboriginal children in the Northern Territory have been on the rise since 2015 despite substantial government efforts into screening, surgery and antibiotic treatment. This indicates the F&E components of the SAFE strategy are currently lacking. Based on the identified relationship between ocular and nasal discharge, flies on the face, and trachoma infections in comparable international populations, programs focusing on both keeping children's faces clean and environmental improvements to reduce flies are recommended. Programs that promote clean faces should be implemented to focus on both a community and an individual level. Programs should follow recommendations from the World Health Organization and should include upgrades to community washing facilities and bathrooms, ensuring all households have access to working washing facilities with clean running water, provision of personal hygiene products such as hand and face wash at a community and individual level, education at community level on the importance of hand and face cleanliness for the reduction of trachoma as well as other easily spread diseases, building self-efficacy in the community, families and children to be able to maintain high levels of personal hygiene and clean faces. Control of bushfly numbers is difficult at a large-scale level. Instead, programs should focus on improving housing infrastructure and living conditions alongside pest control at a community level and the provision of insecticides to households to control fly numbers at an individual level. Upgrades to infrastructure should include installation of fly screens to keep flies out of houses and ensuring all households have access to working sewage facilities. Despite bushfly numbers on the rise due to changes in climate and increasing temperatures, implementation of environmental programs should better equip communities to cope with fly infestations and decrease fly to human contact. Effective hygiene programs should increase the face cleanliness in children, resulting in both a reduction of trachoma infections spread through human-to-human contact and decreasing the number of flies attracted to faces. Surveillance of trachoma prevalence alongside the implementation of suggested programs may also contribute to filling a current gap in the literature examining the bushfly as an independent risk factor for trachoma in Australian populations. Increasing hygiene practices, improving living conditions, decreasing fly-to-human contact should not only have a positive impact on trachoma, but also reduce other easily spread diseases and improve overall health in the remote Northern Territory Indigenous population.